Let's get straight to the point. 8. The biofilm slum city. Look at you sitting there, breathing through that mouth like it's some pristine cave instead of the bacterial metropolis it actually is. You probably brushed this morning for 30 seconds and thought mission accomplished, completely oblivious to the fact that you're hosting a thriving civilization of microbes that would make a petri dish jealous. Wrong. Here's the deal. That slippery film you feel on your teeth isn't just morning fuzz. It's a sophisticated biofilm, a three-dimensional bacterial city complete with high-rise apartments, sewage systems, and communication networks. You think you're clean because you can't see it, but you're basically walking around with microscopic Manhattan built on your molars. Scientists call this a multi-species microbial biofilm, and it's more organized than your entire life. These bacteria produce a sticky matrix of proteins and polysaccharides that acts like concrete, protecting them from your pathetic brushing attempts. They communicate through quorum-sensing, basically bacterial text messaging, coordinating attacks on your enamel. The pioneer species, like Streptococcus mutans, lay the foundation, then secondary colonizers move in, creating layers of different bacterial neighborhoods. Each layer has specialized functions. Some produce acid, others release toxins, and all of them are working together to dissolve your teeth from the outside in. Here's the scary part. Within 24 hours of forming, this biofilm becomes resistant to antibiotics and antimicrobial agents. It gets worse if you leave it undisturbed for 48 hours. It calcifies into tartar, becoming harder than concrete and impossible to remove with brushing. You're literally letting bacteria build permanent condos on your teeth. Your mouth is like a construction site where the workers never got the memo that they're supposed to leave. Instead, they've moved in permanently, started families, and begun urban planning on your enamel. Brush for 2 full minutes, twice daily, and floss like your social life depends on it. Because it does. 7. The sulfur gas factory. Admit it, you've done the hand-cup breath test and lied to yourself about the results. Not too bad, you whisper, while people around you are literally holding their breath during conversations. Your mouth isn't producing morning breath, it's manufacturing chemical warfare agents that would make a skunk jealous. But here's the truth. Your toxic breath isn't random bad luck. It's volatile sulfur compounds being mass-produced by anaerobic bacteria living in the oxygen-free zones of your mouth. These microscopic chemical factories are breaking down proteins from food debris, dead cells, and blood from your constantly bleeding gums, then belching out the same gases found in rotten eggs and decomposing corpses. The main culprits are gram-negative anaerobic bacteria like Solobacterium murre that thrive in the deep grooves on the back of your tongue. They possess proteolytic enzymes that specifically target amino acids like cysteine and methionine, producing hydrogen sulfide, methyl mercaptan, and dimethyl sulfide as waste products. Translation, they're literally pooping sulfur gas into your mouth. Studies show the rough surface of your dorsal tongue traps protein debris like a shag carpet, creating perfect anaerobic pockets where these bacteria multiply faster than your excuses for not flossing. Here's the scary part. These sulfur compounds are actually toxic to your oral tissues. They increase the permeability of your gum lining, allowing more bacteria and toxins to penetrate deeper, accelerating gum disease. It gets worse. Chronic halitosis often signals underlying periodontal disease, systemic infections, or metabolic disorders. Your breath isn't just offensive, it's a chemical alarm system screaming that your body is rotting from the inside out. Your mouth is basically a miniature sewage treatment plant that's backed up and overflowing, except you have to taste it and everyone else has to smell it. Scrape your tongue until you see pink, floss the food graveyard between your teeth, and drink water like you're not trying to mummify yourself. 6. The acid bath demolition derby. You really think sipping that energy drink all day is harmless refreshment? Look at you, bathing your teeth in liquid destruction while acting like you're just staying hydrated. Every sip drops your mouth's pH into the danger zone, turning your oral cavity into a chemical weapons facility targeting your own skeleton. Here's the deal. Every time you consume sugar or refined carbs, bacteria like Streptococcus mutans throw a feeding frenzy, fermenting those sugars and excreting lactic acid as waste. Your mouth's pH plummets below 5.5, the critical threshold where your enamel starts dissolving. You're not just drinking soda, you're mainlining enamel solvent directly onto your teeth. Scientists call this demineralization, the process where hydroxyapatite crystals _1010O_4_60_$2 that make up your enamel literally dissolve. The acid pulls calcium and phosphate ions out of your tooth structure at the molecular level. Your saliva tries to buffer this chemical assault with bicarbonate, but you're chugging acid faster than your mouth can neutralize it. Studies show frequent acid attacks keep your oral pH in the danger zone for hours after each sugary assault. Add chronic dehydration from caffeine addiction, and you lose your natural defense system entirely. Here's the scary part. Once enamel is gone, it's gone forever. Your body cannot regenerate it. The bacteria then attack the softer dentin underneath, creating cavities that tunnel toward your nerve like acid-powered drill bits. It gets worse when they reach the pulp chamber. You get excruciating infections that require root canals or extractions. You're literally paying dentists to remove parts of your skull that you dissolved with liquid candy. Think of your teeth like marble statues being power washed with battery acid 10 times a day. They don't explode immediately, they just slowly dissolve into soft yellow stumps. Stop marinating your bones in sugar acid, use a straw if you must drink poison, and learn what water tastes like. 5. The gum recession disaster zone. You notice your teeth looking a little longer lately and blame genetics or aging, completely missing the fact that your gums are literally evacuating your mouth like refugees fleeing a war zone. And they are fleeing the war you started by treating your gum line like a bacterial dumping ground. Spoiler alert, gum recession isn't cosmetic, it's structural collapse. When plaque accumulates along your gum line, it triggers chronic inflammation that destroys the periodontal ligament and alveolar bone supporting your teeth. Your immune system goes nuclear trying to fight the infection, but ends up destroying your own support structures in the process. You're basically carpet bombing your own mouth. The bacteria responsible include aggressive anaerobes like Porphyromonas gingivalis and Tannarella forsythia that release proteases and lipopolysaccharides enzymes that literally digest your gum tissue and bone. These pathogens create periodontal pockets, infected caves around your teeth where oxygen can't reach, allowing even nastier bacteria to thrive. Studies show this chronic inflammation increases systemic C-reactive protein levels, linking gum disease to cardiovascular disease, stroke, and diabetes complications. Your mouth infection is poisoning your entire cardiovascular system. Here's the scary part. Receded gums expose your tooth roots, which aren't protected by enamel. The exposed cementum is soft and vulnerable, leading to root cavities and extreme sensitivity. It gets worse once gums recede past a certain point, they don't grow back. You'll need painful gum grafting surgery where they harvest tissue from your palate and stitch it over the damaged areas. Some people lose perfectly healthy teeth because the foundation rotted away. Your gums are like a retaining wall slowly collapsing while toxic sludge pours through the cracks, undermining the entire structure until your teeth fall out like tombstones in a mudslide. Floss daily, get professional cleanings, and stop ignoring bleeding gums like they're a minor inconvenience instead of a medical emergency. 4. The tongue carpet fungal farm. Go look in a mirror and stick out your tongue. See that thick white coating that looks like cottage cheese mixed with death? You probably shrugged and walked away, thinking it's normal. That fuzzy layer isn't normal, it's a thriving ecosystem of bacteria, fungi, and decomposing cellular debris that's turning your tongue into a biological hazmat site. But here's the truth, that coating is a concentrated colony of microorganisms living in the papillae, those tiny bumps that create perfect hiding spots for bacterial communities. When your oral microbiome gets disrupted by poor hygiene, antibiotic use, or sugar overload, opportunistic organisms take over. You're essentially cultivating a mouth garden of filth. The white patches often contain Candida albicans, a dimorphic fungus that switches from harmless yeast to invasive hyphal form when conditions are right. These hyphae are root-like structures that penetrate your tongue tissue, anchoring the fungal colony and making it nearly impossible to remove by brushing alone. Mixed in are anaerobic bacteria producing the same volatile sulfur compounds responsible for breath that could strip paint. Studies show tongue coating can harbor over 500 different bacterial species in concentrations 10 times higher than saliva, creating a concentrated reservoir of oral pathogens. Here's the scary part. This microbial sludge gets swallowed constantly, seeding your gastrointestinal tract with pathogenic bacteria and potentially causing systemic infections if your immune system is compromised. It gets worse. The fungal overgrowth can spread down your esophagus, making swallowing painful and destroying your sense of taste. You could lose the ability to enjoy food because you let fungus colonize your taste buds. Your tongue is like a bathroom mat that's never been washed soggy, stepped on by everything nasty and slowly transforming into a living carpet of microscopic horror. Get a tongue scraper and drag it like you're peeling wallpaper until you see pink tissue instead of biological sludge. 3. The calcified concrete bridge. Look at the back of your lower front teeth in a mirror. See that yellowish, rock-hard crust bridging the gaps? You probably tell yourself it's just how my teeth are shaped, but that crusty buildup isn't tooth, it's fossilized bacterial colonies that have turned to stone on your enamel. You've let plaque calcify into dental concrete. Here's the deal. That's calculus or tartar plaque that's absorbed calcium and phosphate from your saliva and hardened into a substance tougher than your tooth enamel. This isn't just cosmetic buildup, it's a bacterial fortress that provides the perfect rough surface for even more plaque to accumulate. You've created a self-perpetuating cycle of filth that no amount of brushing can remove. The mineralization process involves precipitation of calcium phosphate salts, including hydroxyapatite, octocalcium phosphate, and brushite. This calcified matrix becomes home to the most destructive oral bacteria, the red complex pathogens, Porphyromonas gingivalis, Tannarella forsythia, and Treponema denticola. These are the bacterial equivalent of organized crime, releasing gingipanes and other proteolytic enzymes that systematically destroy your periodontal ligament and alveolar bone. Studies show calculus acts as a bacterial reservoir, constantly seeding your mouth with pathogens that cause aggressive gum disease. Here's the scary part. As this concrete bridge grows, it physically wedges your gums away from your teeth, creating deeper pockets where even nastier bacteria thrive. It gets worse. The calculus can become so extensive that it's actually holding loose teeth in place. When a dentist finally removes it, your teeth might wobble because the bacterial concrete was the only thing preventing them from falling out. It's like letting barnacles grow on a ship's hull until they're the only thing preventing the hull from disintegrating. You've structuralized your own decay into a load-bearing bacterial formation. See a dental hygienist to jackhammer that concrete off your teeth, then floss daily to prevent the bacterial construction crew from rebuilding. 2. The infected pressure cooker. You've felt that deep, throbbing heartbeat inside your tooth that wakes you up at 3 a.m., haven't you? You pop some ibuprofen and pretend it's just sensitivity, ignoring the fact that you're harboring a high-pressure infection chamber inches from your brain. That pain isn't random, it's your tooth screaming that it's dying from the inside out. But here's the truth. When a cavity reaches your tooth's pulp chamber, the soft tissue containing nerves and blood vessels bacteria invade, and the tissue begins to necrose. Your body tries to fight the infection by sending white blood cells, but they're trapped inside a hard shell with nowhere to go. The accumulating pus creates pressure that compresses the nerve, causing that excruciating throbbing that syncs with your heartbeat. Scientists call this a periapical abscess, a pocket of pus and dead tissue at the root tip. The main bacterial culprits include anaerobic streptococci and gram-negative rods that thrive in the oxygen-free environment of dead pulp tissue. As they multiply, they produce toxins and gas that build pressure inside the tooth and surrounding bone, causing acute osteomyelitis. The inflammatory mediators like prostaglandins and bradykinin sensitize nerve endings, creating pain so intense it can cause nausea and prevent sleep. Here's the scary part. If the pressure isn't relieved, the infection will find the path of least resistance. It can tunnel through your jawbone and erupt through your gums as a pus-filled fistula, or worse, spread into the fascial spaces of your neck, potentially causing Ludwig's angina, a life-threatening condition that can close your airway. It gets worse, the infection can travel to your cavernous sinus and cause brain abscesses. People have literally died from just a toothache because they ignored a dental infection. Your infected tooth is like a pressure cooker with a blocked valve. Eventually something catastrophic has to give, and it won't be pretty. Don't tough out dental pain. Get a root canal or extraction before your next medical emergency is courtesy of your own stupidity. 1. The bloodstream highway invasion. Here we are at number 1, the ultimate horror of your disgusting oral habits. You think your mouth problems stay in your mouth? You naive fool. Every time your gums bleed during brushing or flossing, you're opening direct highways for bacteria to march into your bloodstream and colonize every organ system in your body. You're not just destroying your mouth, you're systematically poisoning yourself from the inside out. Here's the deal. Your mouth is highly vascular, and inflamed gums create direct access points between your oral bacteria and your circulatory system. Every time you chew with diseased gums, you're performing bacteremia, literally injecting millions of pathogenic bacteria into your bloodstream. These aren't just floating around harmlessly, they're actively colonizing distant organs and triggering systemic inflammation that ages you from the inside. Oral pathogens like Porphyromonas gingivalis and Fusobacterium nucleatum have been found in atherosclerotic plaques, contributing to heart disease and stroke risk. Scientists have discovered DINA from oral bacteria in the brains of Alzheimer's patients, suggesting these microbes cross the blood-brain barrier and cause neuroinflammation. The bacterial lipopolysaccharides and proteolytic enzymes trigger chronic systemic inflammation, elevating C-reactive protein levels and damaging blood vessels throughout your body. Studies link severe periodontal disease to increased risk of heart attacks, strokes, diabetes complications, rheumatoid arthritis, and even colorectal cancer. Here's the scary part. This isn't just correlation, it's causation. Your mouth bacteria are literally contributing to the diseases that will kill you. It gets worse. Pregnant women with gum disease have higher rates of premature birth and low birth weight babies because the inflammatory compounds cross the placenta and affect fetal development. You're not just poisoning yourself, you're potentially poisoning the next generation. Your bloodstream is supposed to be a sterile highway system, but you've turned it into a bacterial superhighway where oral pathogens commute to your heart, brain, and every other organ, setting up permanent colonies of destruction. Treat your mouth like it's connected to your entire body, because it is. Brush, floss, get regular cleanings, and stop pretending oral health is optional when it's literally life or death. All right, you walking biological disasters. That's the list. Now that you know your mouth is basically a terrorist training camp for bacteria that want to destroy your entire body, do something productive for once. Smash that like button. It's probably the only thing you'll hit harder than your enamel with acid today. Hit subscribe because you clearly need someone to explain basic human maintenance. Share this with someone whose breath could be classified as a chemical weapon. I'm Sticky from Coolest Dudes, and I'll see you next time.